All right, so let's just talk a little bit about eye movements. If I know I want to activate the right cortex over here, which includes the frontal lobe, I'm going to do exercises that specifically activate only the right cortex, only the right frontal lobe. And those are going to be saccades to the left. Right frontal lobe pushes the eyes in a quick movement to the left. Now, if I want to activate the right parietal lobe, which I'm going to draw just a little lower here, but it's really not how it looks in the brain, but then what I'm going to do actually is this is going to be a different movement altogether. It's going to be a pursuit, meaning not a quick movement, but just a smooth eye tracking movement. But it's actually going to be to the right. So you're going to follow a target slowly. It's going to look kind of like this. If there was a ball moving across the screen, it's just going to go follow. The eyes are going to be following it slowly across. Whereas the saccades were the opposite direction, and they looked from one point to another. So what you're seeing here is that two opposite directions, because they're different eye movements, actually activate the same side of the brain, which is pretty cool, right? So that's neat. So what about, like, let's say I want to get optokinetics involved, right? I want to use the OPK. Well, what you want to really do is say, what's the first activity involved in the optokinetics? Well, the first thing you do is it's a pursuit. So the optokinetics, alternate red and white squares, right? So we're going to leave the white as absent there, but it's there. So the first thing that it does is going to, you end up grabbing the target here with your vision, your occipital lobe, and you follow it for a minute until it comes back, till the next one comes into play, and then you jump over to that one and you follow that for a minute this way, and then you jump to the next one. And so what you're doing is you're creating a pursuit phase first, where you're following the target over to here with your parietal lobe, and then your frontal lobe is taking that, stopping there and seeing the next one and jumping back to center. Now that fires both two areas, the frontal and parietal lobe, temporal also, of the same hemisphere, which is the key. What's very cool is that when we terminate accurately on the target, we're actually using we're using the cerebellum. So the cerebellum is what we use to stop our eye movement. It's like accuracy, like we use our finger to point at something, we use our cerebellum. Well, when we're trying to create accurate, like smooth eye movements and in a termination, we're going to use that cerebellum to get that job done on the opposite side. So if I'm looking quickly from, right to left here, then the left cerebellum is going to stop it. Okay? And if you want to think about it like this, it may be helpful. Hopefully, it won't be confusing, let's say. But the cerebellum, the vestibular system, and the brainstem, what they do is, I'm just going to erase this. Is they push in for like this side here, this side here, this side here. That's going to push the eyes to center. The opposite side is going to do the same thing. And so what's happening is that each half, this side is pushing the eyes this way, and this side is pushing the eyes this way. What that does, it keeps our gaze center. It gives us good gaze stability. Being able to balance, have this nice even balance of like, you know, it's kind of different because in tug of war you're pulling, but let's just say like the strength of the kids over here is the same as the strength of the kids over here, so the midline doesn't move. But if we, and you can remember this, right? If you look at your thumb and you turn your head to the left, which ways did your eyes go? They went to the right. So if you remember, if you saw that, that's just this in action. That's all of this stuff playing a role in moving the eyes this way. But they shouldn't keep going past it, right? They should be accurate. Should be able to stay in your thumb because these guys are accurate and strong too, so they keep it in check. So they're not going to let you overdo it because this balance, this symmetry, if you will, this balance is what keeps really healthy, accurate signals. And that occurs everywhere in the brain. It's what's happening with your sympathetic system. When you have balance between that parasympathetic and sympathetic system, then you're going to have a balanced output. There's not going to be too much or too little. It's going to be just the right amount. And the same thing occurs here with these eye movements. So really, if we think about it, that's, you know, a really important function of the brainstem is gaze stability, which we've talked about a lot. It really lives kind of right in here at center, but it gets all this input from these guys and these guys that help it, and also honestly from the cortex too, that allow us to have a balanced position of our eyes. Pretty cool, I think. Okay, so there's that, but then there's looking to the sides, but then there's also this one that we talk about a lot, which, allows us to look at our thumb up close, right? Kind of like cross our eyes. And that's really important because in order to look at something close, of course, you have to move your eyes, but then you have to be able to disengage that close movement when you're looking at something far away. And so looking at something up close comes from actually your mesencephalon, right here, in your convergence centers. So the right side controls the right eye converging and the left side controls the left eye converging. Now, what also contributes to that is your vestibular system. And so your otolithic system also contributes to that through the cerebellum and through the different things. So that also helps because essentially if you're moving your head back moving your body, translating, accelerating forward towards an object or away from it, you've got to move your pupils in response to that movement to keep constant gaze and focus. Because really, it's always about keeping your gaze in focus on the object, because as soon as you get away from 2 degrees from the fovea centralis, information, like vision starts to get blurry, and we don't like that. Okay? So when we have a problem, let's say of one or both of these sides, one thing that can happen is called this convergence insufficiency, where you get this scenario where the person comes in, and you've got their their pupil, on the left comes in, but the right one stays out. It doesn't, I probably should use the same type of thing, but it doesn't come in like the other one does. And so we say, maybe there's a problem here, or maybe there's a problem here. And so if we say if there's a problem here, then that actually must be coming from this side, somewhere over here, this left brainstem, because information crosses over. So we say, if a patient has a problem with convergence insufficiency there, and their pupil also happens to be bigger or more fatigable, less responsive, we say, gosh, that's another indication that there's more evidence for this left side over here being a problem. Likewise, sometimes, or what also happens, I guess likewise isn't the right term, but what also can happen is that patients can get kind of stuck here. They get this thing called a convergent spasm. And their eyes go, they kind of shimmy a little bit in here, and they get kind of stuck, and they start to bring your thumb back out from their nose, and these guys kind of jump a little bit here. They like get kind of like they're catching on something. You can see them. It's not smooth. And that happens when the mesencephalon is firing, once again, in kind of our sympathetic nature of a conversation from before, firing way too much. And that's when we have this high, sympathetic output. It starts to really ramp these guys up and increases the spasm in the eyes. And the same idea, it's not usually like the whole system. It's typically, like one side or the other. And, we have to just go in and figure out, oh, yeah, maybe it's this more, or this, as we're going to keep it in the same mentality as before. And we say, it's this kind of left cerebellum, cortex area on the right that's causing this dysfunction. Once we start to stimulate this better, all these things start to calm down, and we start to decrease the locking of that mesencephalic activity, and these guys get chilled out, and then we can move our eyes easier without a problem. Because we've got to be able to do it. So it's not like these systems shouldn't be there, right? They should be firing and sending signals. We need sympathetics. We need sympathetics down to the body, once again, to pump blood flow. We just want them to be able to turn off when we need them to, again, right? So it all has to do with, can it turn off when needed or when appropriate? And that means sometimes as soon as it turns on, it's got to turn off, right? So it's like, it happened, okay, you're done. No more you. And that's what we kind of see with this sympathetic drive in the pupils, is that we need them to turn off so that they don't get locked in this kind of concentric position. All right. I think that's enough for you guys to chew on for a little while.